I'm Darren from Sterile Services. I'm the Sterile Services Operations Manager.
And I'm Mike Horrocks. I'm the project manager for the Sterile Services project.
So we disinfect and prepare and sterilize 3.3 million instruments or medical devices per year, ready for patients' operations. Everywhere that uses a medical device within the county, whether it's a doctor's surgery, hospital, clinic, and then down to the main operating theatres. The building since 1986. That's where it's first commissioned. It's aged over the time, so hence why we need the improvement within the building.
It's about a 12-month program of refurbishing the building. One of the most difficult challenges around this building is a 24/7 operation. So most often, spaces will be handed over to the project team and handed over to contractors, and it's all their space, and they can crack on and do things at a fairly rapid pace. Here, we've got to keep the operation running whilst it's being refurbished. So there are a number of quite tricky handover phases in which part of the space is being used by Darren's team to process equipment, and the other space is going to have the contractors and doing the refurbishment works. There are three main elements to this. One is the washroom, and what we're doing is improving the flow through there so that Darren and Matt's team can more efficiently carry out their works. There's also the clean room, which is where the bulk of the work happens, and that's about packing up equipment ready for sterilising the autoclaves. That's having a new ceiling fitted. The key benefit there is really to enable the maintenance and operation of the space to happen without having to shut down. So again, keeping that 24/7 operation going. And to do that, we have to create a temporary clean room. So that's what's being refurbished, and we'll show you pics of that in a short while. We're able to complete this side of Christmas, though we suspect it's going to be early in the new year. It depends on what we find. There are still some technical challenges with the building. It's an old building. Not always are we able to work out exactly what the issues with the building are until we started the project. Sometimes you open things up and you find there are challenges.
So some of the instruments that we deal with go into the eye surgery, to heavy orthopedics with a hip replacement, knee replacements, and then we go down to dental and podiatry instrumentation. Some of the instrumentation, we're looking at a laparoscopic kit around about £30,000. That we have to make sure we take care of, and those laparoscopic kits, we have about 56 in the trust that we take care of. And so we can see those laparoscopic instrument trays. We'll probably see each tray roughly about 3 times within the week at least, dependent on activity within each theatre, across all 3 sites they're doing. So we have contracted within SSD, we have 74 whole-time equivalent staff members, and that's working from Monday 6 o'clock in the morning until Sunday at 3:30 in the afternoon. We have an on-call service on a Saturday and Sunday evening. So compliance is overall key. So we're going to have a really, really good compliant ISO packet room, so a clean room where we can expect, assemble, pack instruments in a better environment of working. From a washroom perspective, the staff are going to have a better environment of working, where there'll be more central working alongside our washer disinfectors. The main thing is benefiting the staff's environment of working. That's what we're hoping to achieve. To allow a patient to be discharged from the hospital, from a surgical point of view or procedural point of view, Sterile Services plays a vital cog in that role.